Basic Care and Comfort. Question 1. This is the first question. Question 1. Which of the following action indicate better understanding of the procedure? A new graduate nurse receives the following order: 1 amp of calcium gluconate. Which of this indicates understanding? How do you do that? Inject with a filter needle, withdraw with a regular needle, use gauze to break the neck towards the body, tap the top part of the bottle with your fingernails. What do you guys think? The best way is to know what is involved. If you have the bottle like that, an amp bottle, it has a top over here like that. You flick it, okay? You flick it with your finger so that the medication will fall down. Okay, you use the alcohol around the neck and you break it away. So use gauze or alcohol to break the neck towards you is wrong. It's away from you. Then you withdraw with a filter needle so that you don't lose the medication. So you don't withdraw with the regular needle. Then you inject with the regular needle. So injecting with the filter needle is wrong. You withdraw with the filter needle. And so this is the only answer that you need. So withdraw with the filter, inject with a regular injectable needle. The glass will move away from you so that you don't injure yourself and you dispose the rest. So 4 is your right answer. It's just a concept. Most of these questions are a concept. Which of the following action is appropriate by the nurse? A 13-year-old present to the community clinic with what? I'm going to underline the buzzwords: fruity, malodorous, penile discharge. Client was informed by his girlfriend of recent diagnosis of gonorrhea. Which of the following action is appropriate? That means, break it down. His girlfriend has gonorrhea. Now he's having fruity, malodorous, penile discharge. Look like he has the same symptoms. He present to the community clinic. Which of these you think the nurse should do? What do you think? Request presence of a parent, ask for a legal guardian, treat the client, or tell the client that it's illegal to treat the patient. What do you think? This is straightforward. You have to know about STD and underage. Is a minor. If you are a minor, can you get treatment for STD? You should know that, right? What do you think? If you're a minor, you should be able to get treatment. So the nurse should do that. You don't need it. Presence of a parent. You don't need a legal guardian. It's legal to do that. STD, alcohol, rehab, all those things can be done without a consent. So that's a concept. All these questions are concepts. They are not that hard concepts you have to know. How should the nurse respond? Therapeutic. 55-year-old male with abdominal aortic aneurysm is scheduled for what? Elective repair. On the morning of the surgery, the client said, I don't want to have this surgery anymore. What would you say? The doctor will be happy to know that you are in the best place for this type of surgery. Please tell me your concerns about the surgery. This happens all the time. You will be fine, I promise. You have to be therapeutic. You have to be therapeutic. The doctor is not going to be happy that you're not having surgery. He want to operate on you. How do you know the client is at the best place? I want you to tell me more. Open statement. This happens all the time. No, I don't care about all the time. I care about me, myself. So figure out what is wrong with me. Therefore, this is good. Concept, right? Number 4. Which of the following is the best response by the nurse regarding dehydration in a dying client? Concept. A nurse is caring for a terminally ill client on oncology ward. The family noticed chapped lips and cracked lips. They are concerned about dehydration. What should the nurse say? I will get a primary care doctor to place a central line right away. Okay, we will bolus the client with normal saline. Dehydration releases endorphins that suits the client. I know your concerns, but let us do our job. Concept. Client is dehydrated, is dying, and the parents are concerned, or the family members are concerned about it. What do you think you should do? You have to be therapeutic, but if you know something, you tell them. You educate them. It's a chance for education. Chance for education. This central line is not going to fix the problem. There's a reason why the client is dehydrated. He's dying. I told you, anorexia in somebody who is dying is good for the body. It helps them. That's why they don't want to eat. They don't want to feed a dying body. That's natural. Bolusing them will not solve the problem. It's well known when you dehydrated, you release endorphins, which provide comfort to the dying patient. So this is the concept. This is tricky. You shouldn't say that. So even if you don't know, you find an answer, be therapeutic and teaching. Therapeutic and teaching. If it's therapeutic and I'm teaching you, then it's a good answer. That's all. Number 5, select or apply. 4 answers, but select or apply. Which of the following action is appropriate? A client required vest restraint due to clinical condition. Which of the following action is appropriate? Place the restraint under the gown, tie the straps to the bed rails, place client in a supine position, select the correct size. Think about it. A vest is a vest, is a vest. And I'm restraining you with the vest, with the tie on it. And this is the individual. What do you want to do? Select or apply. This is a trap answer question, just to trap you. It's a vest, right? If I put a vest on you, do you want to lay supine? You won't be able to breathe. So proper position, a little bit upright will be good for them. So this is gone. The bed rails is never good for tying things because it's movable. You want to tie things to the frame that is not movable. So this is done. You cannot put the vest under the gown. You put it on top of the gown. Therefore, select the correct size for the patient. Only one answer. I intentionally said it like that so that you have to think about your answers. You can get 4 questions for answer choice, and you have to break it down so that you don't make a mistake. Only one answer there. You pick more than one is wrong. Which of the following plan of care the charge net should intervene? You see, I keep on underlining the keywords so that I can let you focus on that. A new graduate nurse is caring for a client with what? Cognitive deficit, admitted for surgery. What would you include? Keywords. Cognitive deficit is having surgery. What would you include in the plan of care? A clutter-free environment, an object to reorient the client, a family member to provide one-to-one sitter, reintroduce serve each time of an encounter. What do you think? Of course, you want safety. So this provides some safety. So that's good. If you reorient, he has cognitive deficit, so reorient them. by taking an object. You can give them a clock. You can look at the clock. You say, oh, it's 8 a.m. Today is Saturday. So this is good. You can use family members to help with your care, but you can't use them forever. A one-to-one sitter by a family member? No. Your nurse's job, your job, you cannot delegate completely to a family member. Yeah, they can help a little bit, but to be a one-to-one sitter, this is bad. He has cognitive problem. Every time you go in, oh, I'm RN, so and so. Introduce yourself, reorient them. So this is good. Therefore, this one, we got to do. Okay. So we got to, the family member cannot provide complete care for a patient. There's no way. They can provide some care, but no, they are not the one-to-one sitter. You got to pay them to do that in your hospital. That's something you should know. You can't delegate everything to. You can teach them to do things, but they shouldn't be responsible the one who providing one-to-one for your patient. Which of the following is a priority prioritization? A nurse is caring for a client who arrives to the med-surg ward afterward. Endoscopic, gastroduodenoscope. Client does not have what? No gag reflex currently. Those are the words you focus on. I'm underlining to show you how to answer the question. So I've underlined. I have endoscopic gastroduodenoscope. That means EGD. I have no gag reflex. What should be my priority? Keep the client in a supine position and chin down. Keep the client, teach the client to keep chin down while swallowing. Teach the client to keep chin extended back while swallowing, or keep the client in the semi-phalar position and chin extended back. Which one you think is good? You practice it. If you put your chin back, you are obstructing your airway. So definitely this is bad. If you keep them in supine, it's bad. You always want your chin to be down while you kneel forward a little bit when you swallow, and that will prevent aspiration. Chin in semi-phalar position with chin extended, that means to the back, you're obstructing, you're going to swallow and aspirate. So this is bad. This is the best way. The chin down while you swallow is the best way to do that, to prevent aspiration. He has no gag reflex. So that's the best way. Number 38, number 8, selected apply. What is the next response? A 35-year-old client with recurrent what? Cystitis asked the nurse how to prevent this infection. So once I'm teaching, teach me so that I can prevent infection. I keep on having cystitis, right? Bladder infection. Drink 8 ounces of water a day. Empty your bladder every 2 to 4 hours. While awake, wear polyester briefs. Clean your perineum from back to front after defecation. And some vitamin C. What do you think? Drinking a lot of water is always good. Right? You empty your bladder so you have a schedule. That's good. Excellent. Polyester brief is bad. You want cotton. Cleaning from your back. That means the inner area to the urinary system. That's not good, right? You have to clean from front to back. Okay, front to back, so that you don't put things in the urinary tract and cause infection. So 4 is wrong. And you have to acidify the urine. Vitamin C is good. Cranberry juice is good. Avoid bicarbonate drinks. So 5 is also good. So 1, 2, and 5 are your friend. You don't have to pick everything. I want you to pick those you're confident. Pick you have 101%. There's no need to pick 5. Okay, there's no need to do that. Okay, so make sure you drinking a lot of water. 8 ounces is okay. This is not constipation. They don't have to do 2 to 3 liters of water a day. It's not preventing constipation. This is something enough to wash the bladder. Okay. And this is caring for a client who is incontinent to urine. The physician prescribed what? Habit training. Right? Which of the following the nurse should include in the plan of care based in the description? Which of the following the nurse should include in the plan of care based on the prescription? Instruct to void according to a schedule. This is the key word. Void at a regular interval. Remind client to void or encourage client to void. They always use it when they're training somebody with incontinence. When they tell you you should void with the schedule, if you give a schedule, it's different. The schedule is time training. If you do it regular, it's habit. And if you remind and you encourage, it's called prompt. So the best habit is regular interval. The schedule is a time. You're giving a time. It's different from having a regular, you go whenever it's in a regular uniform. But if you schedule 2 o'clock, you got to go 4 o'clock, 5 o'clock, that's schedule. So time is different from regular interval. So habit training is irregular. I'm getting a color. I need to look at question 8. There's no at least there. Oh, okay. It should have been at least here. So it should be at least 8 times a day. So I guess that's why people are getting confused. Should be at least, where is it? Yeah, this should have said at least 8 times a day. So at least. So this is correct. Remember, cystitis is not, it's not like regular constipation. You have to do 3 liters, 2 liters, you know. So there should be at least here. It's omitted. So this is what I was explaining. When it says schedule, you have a scheduled time. 2 p.m., you got to void. 4 p.m., you got to void. 6 p.m., you got to void, whether you like it or not. By interval, regular interval, you're going whenever, within every time you go, every 4 hours, you go. Every 6 hours. It's different from a scheduled time, you go 2, 3, 4, 5. So that's the difference. When you remind the client or you encourage them, it's called prompt. These are part of the incontinence problem. So prompt teaching is different. Definition. Number 10. Which of the following is a priority? Priority plan of care for the entire admission. Pay attention, entire admission, okay? This question, a lot of people will have questions about it, and that's how you learn, you know. It's good to ask questions and questions and answers. To keep people honest, right? Which of the following is a priority plan of care for the entire admission? And this is caring for a client who had right tube tracheostomy placed for pneumothorax. What should be the priority? Provide oxygen to the client, check their vitals every 4 hours, report any drainage to PCP or sterile water and antiseptic wipes at bedside. Which of these is a priority? What do you think for the entire admission? First, you got to break this down. Right tube thoracostomy is just a chest tube. So all the questions asking is, I place a chest tube for pneumothorax. It does not matter. The pneumothorax become irrelevant now. All the question is asking you, you have a chest tube in a patient, what would you do? What should be your priority if you are a nurse? Think about it carefully. So what should be your priority? What do you guys think? I have a patient who has a chest tube. He's sitting down here. And he has a chest tube placed for pneumothorax. Throughout the admission, what should be your priority? What should be your priority? Tell me, you want to provide oxygen to this client? Check the vitals every 4 hours? Report any drainage to the PCP? Or have a sterile water antiseptic wipes at bedside? It's a critical thinking question. When they give you this kind of question, it should be related to what do you think is going to kill the patient? Which of these is going to kill the patient? Think about it before you select an answer. Which of these answers is going to kill the patient? I never tell you, you don't just give people oxygen because they have chest tube. So this is gone. You're going to give them chest tube throughout the day, throughout the admission. We can check their vitals, but is that important related to the chest tube? We know you gotta do routine vital, but what is the priority? What should be your number one? You're not going to report everything, every drainage to the primary care doctor. If you get 1 cc, are you going to report it to the primary care doctor? So that's gone. What is going to kill this patient is critical thinking. What is the problem? Things you're supposed to do when somebody has chest tube, the tube can come out. So because the tube can come out, you always want to have 4 things. You want to have, I'll write it there. There's 4 things you need, 4. You need 4 things. You need 250 ml of sterile water. Okay. You also need a clamp. Okay, you need clamp. But you can have rubber tipped clamp. In case you got to clamp the chest tube if you want to exchange it. You also need a sterile. You need a sterile gauze. And then you need antiseptic wipes. The number 2 that you need have 250 cc of sterile water and antiseptic. When the tube come out from the Purovac and it's dirty, you cut the tip and you put in 250 cc of sterile water while you wait and get another one. If you come out from the patient, you have a sterile gauze already, you slap it there. If you need to change the tube and then you need to clamp the chest tube like 1 minute, no more than 1 minute, you have a rubber tipped clamp. So those are the things you have to pay attention to. All these things is not a priority. Giving the patient oxygen is not solving a problem. Not everybody needs oxygen. The question is a priority plan of care. For the entire admission, you should have these 4 items on the bedside. And number 2, most of the 2 most important, sterile water and antiseptic. That is what is going to kill the patient. You're going to check the vitals anyway, but is that important? Are you going to report every drainage output 2 cc to the doctor? No. So 4 is your boy. Selected apply. Which of the following the nurse should suspect as a nutritional deficit issue? A nurse is assessing a client with nutritional deficit. When you see these words questions, just read right it. What would I see to show that this guy is nutritional deficit? He has a nutritional deficit, or he's malnourished. And if you malnourish, things usually look like they're going down. Right? So things start to go down all day. So even if you don't know the word, it's talking about nutritional deficiencies. So I'm looking for words that, play with the words that doesn't look normal. You're not supposed to pick all of them. But if you pick, fine. If you know them, pick it. But you're not supposed to pick all of them. Okay, what was the answer? The answer, the previous question, it was the last answer choice. So, spoon-shaped nails, that's like vitamin deficiency, usually like iron, right? So this is your teeth, love calorie. If you don't have good dentition, it shows that you're malnourished. When you have cracks at the corner of your lips, yeah, that's what we call angular stomatitis. The skin on your hair, the hair usually like to regenerate. They need a lot of, that's why people with the peripheral artery disease, they are very thin, dry hair. So it shows more nutrition. Of course, anorexic is also nutritional deficiency. They're not eating, BMI is low. It's just straightforward knowledge question. You have to put it together. But think about a question. Like I keep on telling every answer choice, think about it, but don't overthink. And then make sense after you break down the answer choice or the question, it becomes easy. So all of them, the nurse should suspect as a deficit issue. Okay. This is also something you're supposed to know because that's what you'll be doing. Select and apply. Which of the following action indicate the need for further teaching? I got to teach again. A nurse is making an unoccupied bed. The bed is unoccupied. There's no patient there. So you got to make the bed. How do you make your bed? How do you make your bed? Select all and apply. You gather all the necessary equipment. You remove cord bell. Sometimes there's cord bell around the bed. So do you remove it and the drainage equipment attached to the linen? Do you loosen and remove the linen from one side to another? And when you put it back, put bottom sheet first and one side at a time. Then you put the top sheet with the hem side down, then the blanket and the bedspread. Then you replace your pillow, attach all the bed back and the bed in the lower position. Select and apply. It's a sequence you have to know. I know you guys done fundamentals on your wards. They teach you. I know this is the next classic, the skills in making bed. So you should be good at, you know, the sequence. So what do you guys think? Select and apply. Help me out there. Which one need further teaching? Of course, you got to gather your equipment, so you don't need the teaching. You got to remove old stuff from the linen because you got to wash it. And you got to start from one end. As you loosen and remove it, you cannot just rip it off. And when you lay in the sheets, you start from the bottom one first, not the top one. And you place the top sheet by the hem. This is the problem. It should not be down. It should be what? Up. And then you replace the pillow. So the only thing that needs further teaching is 5. So this is your right answer, just one answer choice. Number 5, the hem should be up, not down. So there's only one answer choice. This is need further teaching. Okay, guys, number 13. This is also words. Select or apply. I want to trap you. If you find the keywords, the answer choice is easy. A bunch of jargons over there. Which of the following method is a method? Is used for short-term enteral feeding. The next should include. And next is orienting new graduate on method of providing nutritional needs to the client. Which one is for short-term? Total parental nutrition, gastrostomy, G-tube, percutaneous endoscopic gastrostomy, jejunostomy, nasogastric tube, percutaneous endoscopic jejunostomy. I just want to trap you, confuse you, but it's a straightforward question. Find the keywords, and you'll be able to like eliminate a bunch of them. So which one is the short term? What do you think? Words, play with the words and help me. What is your right answer? It's a select or apply. You don't have to pick everything. Pick those you're confident, but the keyword is what short term. Nutritional feed. You have 15 seconds. Keyword short term nutritional. What do you think? So let me show you how to take a test. The word says enteral. That means I'm going into the GI tract. The first question, parenteral. Answer choice is gone. TPN is not enteral. That is gone. All this requires surgery. So one, you shouldn't pick one at all. It's parenteral. The thing say enteral. So one, there's no way you should pick one. All these things require surgery, and they are for long term. They are just words. The only thing that is temporal is NG tube, but the rest are all long term. You should not pick one, and you know these are all similar. How would this be, and this is not, and that, and that? This is the same thing as that. They all surgery, but different name, different location. Gastrostomy is in your stomach. Percutaneous endoscopic gastrostomy is the same thing. I'm placing it, the tube in your stomach, but I'm going through the skin phase. Jejunostomy, I go into the jejunum. Percutaneous endoscopic jejunostomy, I place it, but I'll go through the skin. They are the same. I'm just trapping it. 4 and 6 is the same. 2 and 3 is the same. It can be. And because something you do in surgery, it's not going to be short-term, a little bit long-term therapy. The only thing is NG tube. Nobody go home with NG tube. And the first one is parenteral. It's a TPN. It should not go, it's not going to the abdomen. Therefore, it's not going to the GI tract. So the only answer choice is number 5. And next is teaching a client who is prescribed home oxygen. Okay, home oxygen. Prescribe home oxygen. On safety measures. Which of the following the next should include? Oh, I'm asking you, oxygen. How do you take care of your oxygen if you are home? That's all. No smoking sign in the house when oxygen is in use. Avoid clothing or linen with what? Cotton fabrics. No alcohol near when using oxygen. Know where the fire extinguisher is located. the oxygen is used, right? You should not avoid cutting. That's the wrong answer. Alcohol is it can cause fire. So keep electricals in good condition so that they don't provide sparks, right? Know where the fire extinguisher is located. You got to know where the extinguisher is located. Make sure your electricals are in good condition. They don't spark. Okay. No alcohol near the oxygen because it can spark. And make sure when I have oxygen on, you should not put nobody smoke. But cutting is good. Cutting is less. It does not cause too much fire. So that's the best way. So this is the final. Some of the things, these things, you just taking information, and making it a question. So you have to synthesize things you're supposed to know. That's all. Same thing like this one. Which of the following actions indicate the need for further teaching? You should know how to suction a tracheostomy. And this is teaching new graduate on tracheostomy suctioning technique. Which one needs further teaching? There's only a few things. Just know that this is a sterile technique. So one, clean gloves is not the same as sterile gloves. So this needs further teaching. Of course, you're going to pre-oxygenate the client, right? So that's good. Apply the pressure during insertion. You should not apply pressure when you insert, right? You pass the end of the, when you get to the trachea where you bifurcate, you pass at least 1 to 2 centimeters until you meet the resistance, then you stop. So that's good. Withdraw by applying pressure, right? When you are coming out, that's when you apply pressure. You limit suction to 20 seconds. This is too long, okay? 5 to 10 seconds. So once again, you use sterile gloves, you pre-oxygenate the client, you apply pressure up to, usually it's like 80 to 120, but not when you inserting, no pressure when you inserting. This pressure is when you pulling out. So that's why 3 is wrong. And then your suction should not pass 5 to 10 seconds. 2 is right because you have to pre-oxygenate the client. And you don't apply pressure when you're inserting the suction to suction, right? You apply suction when you're withdrawing. So 5 is right. And limit suction to 5 to 10 seconds. 20 seconds is too long. So the answer is 1, 3, and 6. You always have to pre-oxygenate the client when you suction them. Somebody said you can smoke while oxygen is not in use. Yeah, I mean, when oxygen is being used, that's when you can smoke, but you don't smoke closer to that. I mean, it's not like nobody can smoke at home. When it's used, you can, but it's good to have a sign and tell them. The answer choice said, yeah, when oxygen is, don't make it so difficult. The answer choice is no smoking in the house when oxygen is in use. But you can smoke if you're not using the house. I mean, if you're not using it, I mean, you can't prevent them from. You should not go closer. This is the patient. You should avoid cutting. You should rather have cutting. No alcohol near the oxygen. Yeah, I mean, the oxygen tank is somewhere else. So you should not be closer to it. So it shouldn't be a problem. But this question is different. This one, this is wrong. This is also wrong. And this is also wrong. So 1, 3, and 6. Number 16. You got to pay attention what the word is asking. Select or apply. Some of the questions are easy, but you have to, don't read through the question. I want you to pick the buzzwords and forget about every word in the question. When you do that, it gets confusing. And next is teaching a client with what? Gastroesophageal reflux on dietary choice to what? Avoid. Which of the following diet choice by the client need further teaching? That means this patient has reflux. I want them to avoid something. Which of these need further teaching? So they're avoiding this peppermint, they're avoiding caffeine, they're avoiding alcohol, they're avoiding tobacco, they're avoiding chocolate, and they're avoiding milk. It's a select or apply. Is this teaching effective? If it's not, then you pick it. You just want to pay attention. So what do you think? Select or apply. Reflux. Which of these diet choice need further teaching? You ask yourself, if you have reflux, what is the main problem? This is the stomach and the esophagus, and there is a sphincter here. Is this become incompetent? So when it becomes incompetent, things reflux. So you don't want to eat anything that will relaxes the esophageal sphincter. So things that are irritant will do that. Or the cat, caffeine, alcohol, and tobacco. So they are avoiding this. That's good. Peppermint is also bad. And chocolate is also bad. All these things will relax the esophageal sphincter. People always confused. They think milk does not cause reflux. It's okay to eat milk. So the only answer choice is number 6. That's the one that needs further teaching. Milk does not cause reflux. The things that cause reflux is anything that relaxes esophageal. So read the question. Somebody choose 1, 2, 3, 4, 5. I said, which one need further teaching? This, you have to pay attention. Which of the following diet choice by the client need further teaching by the nurse? Not which one is okay. They are avoiding this, so they're doing the right thing. So choosing 1, 2, 3, 4, 5 means that when you're doing something right, you don't need further teaching. So 1, 2, 3, 4, 5 are normal. When they're doing it, it's good. They don't need further teaching. They need further teaching if they avoid milk product. You don't need to avoid milk product. Does that make sense, guys? Need further teaching means you did something wrong. If I have reflux and I'm avoiding peppermint, I'm doing something good. Caffeine, I'm doing good. Alcohol, I'm doing good. Tobacco, I'm doing good. Chocolate, I'm doing good, because all of them relaxes my esophageal sphincter. But if I avoid milk, I'm not supposed to avoid milk. Okay. Then somebody asked about this. The pressure, number 3, I need to explain it. Apply pressure during insertion. You don't apply pressure during insertion. That's what I explained. When you're going into the trachea, if this is the trachea, when you go in, no pressure. Don't apply pressure. When you're coming out, that's when you apply pressure. So withdraw by applying pressure. Yes. Insect, no. And this will tell you test taking skills. There's no way when you insert, you apply pressure, and when you draw, you apply pressure. It does not act like that. It's opposite. And this one, I know is trapping a lot of people. Need further teaching. If you are avoiding this, all this, you're doing good. There's no need further teaching. This is the only one that needs further teaching. So pay attention to the question. If you don't answer the question they're asking you, you become wrong. This is the same thing. Pay attention, select or apply. But there's only 4 choice just to trap you. A nurse is caring for a client who become acutely hypotensive. He become acutely hypotensive. What is the next best action? Let's take this because this is confusing some people now. So let's take the select or apply. What is the next best action? You have a patient, all of a sudden you become hypotensive. Do you place IV? Do you notify the doctor? You place client in a high Fowler position, or you place the client in a supine position? Just give me one answer. Think about it, prioritization. You have to be sharp. What is going to kill the patient? All of the patient is hypotensive. What would you do? You place IV, you call the doctor, or high Fowler position, or supine position? Critical thinking. You don't have time. So if you have 1 second, what one thing you can do to help the patient who is hypotensive? What one question you would do, one thing you would do, 1 second. Patient, you walk into the room, patient is hypotensive. You're going to go and pull all your IV and try to pull, you don't know how long you take an IV placement? You may not even get it. You need a stopper, you need it to prime your stuff, everything. When you give IV, place IV, you got to put fluid. You don't have enough time. You have second. Think about it. What one thing I can do to save this patient life? IV is not going to help them right now. 1 second. Calling the doctor, he will tell you, do something. If you place them on high Fowler, they become more hypotensive. The best way is to put them in the supine position. Flat. Okay? Flat. And your blood pressure will come up. Then you can place your IV. I change it from select or apply to 1. So 1 answer. Flat position is better. Semi-Fowler is not good. Flat or Trendelenburg, they are head down, so head down or supine. Okay, those are the 2 things you do for hypotension. If they are hypoxic, the saturation is going down here, high Fowler position. But you guys need to think prioritization. If you need help, check adapt and class. There's always 1 second. You have 1 second. You don't have time. IV placement takes a while. Even good IV nurses takes them multiple sticks to get in. You can't put IV in. Okay? (18) What is the next best response? A nurse is caring for a client who is scheduled for what? Barium swallow. Client inquire about the utility of the study. I underline the buzzword for you, barium swallow. What is that? And test taking skills. Did I say there is anything? Did I say Yeah, it can be supine or transdeliver, both of them, supine and transdeliver. I give you supine, I never give you transdeliver position, so you can pick one. The question says barium swallow. There is no endoscopic information there. So test taking strategy, just eliminate the endoscopy right away. We are not using endoscopy to look inside. So you shouldn't pick endoscopy. It's a barium swallow. It's a fluoroscopy exams. You're taking pictures. And it's barium, never say anything about what? Large intestines. Large intestine is called barium enema. When it's a barium enema, it's fluoroscopic examination of the entire large intestine. Therefore, 3 is your answer. Endoscopic examination and fluoroscopic examination of the upper GI tract. So your esophagus, your stomach, and your small bowel. Just the upper portion of it. So that's number 3. Is words, okay? And number 19. After providing teaching to a client with diarrhea, which of the following statements need further teaching? That means education. You need to intervene. Bad. And then patient has diarrhea. I want you guys to take tests like that. If you don't do that, you get confused. You don't know what to examine. Patient has diarrhea. You can write it your own words. Write the question in your own words. Underline the buzzwords, then you rewrite it in your own words. I have diarrhea and I need further teaching. That's all. I have diarrhea. I need further teaching. Then you tell yourself, diarrhea, what it means. You're going a lot. Therefore, I need to slow you down. I'm guiding you to pick the answer. Which of this will slow you down? That's the way I do my question. I come up with my content and what I expect, and I look at it. Which of these will slow you down? And they ask you, which one needs further teaching? So I need something that will do what? Slow me down. If you slow me down, it's good. If you speed me up, it's bad. That's all. So which one you think need further teaching? That means it speeds you up. I've given you all the clue. I've given you all the clue. You should not get this wrong. I've given you how to answer this question. I summarize the key fact. Of course, if you're having diarrhea, you need some fluid to replace it. So this is good. You have to Google this if you don't know what a brand food is. It means it's a soft food. It's good for your GI tract. It does not stimulate you. So it's gentle. It has low fiber. So this is good. It slows you down. High fiber diet will speed you up. I don't want to speed up because I'm speeding already up. I will get more diarrhea. If caffeine is a stimulant, so as told you, avoid tobacco, alcohol, and caffeine. If I take caffeine, it speeds me up. If I'm avoiding it, it slows me down. So high fiber diet is not good for this patient. Okay, and that's the way to answer that. And the last one. This one is a bonus question. If all the rest were hard, this is your bonus. A nurse saw fire in the client's room. What is the next best action? You should not mix this. This is a content. I can't teach you that. You should know by now. And I know you know because you're watching at Dr. NCLEX. And thank you for sticking around. So what do you think? If you don't subscribe, subscribe down and check at Dr. NCLEX for more content like that. What is the next best action? What should you do? You saw a fire in client's room. This, you should not mix it. Please don't mix this one. You are in a room, you saw fire, patient is there, save the patient. It's called safety, safety, safety. Save the patient, right? What do you do first? We all know the race. But I think the most important thing about the race is R. Remove the patient from the room, okay, from danger, before you do anything else. You can't leave the patient and go and attack the fire. Okay, you can't leave the patient and go and put down the alarm. You cannot evaluate the area and leave the patient alone. So this is wrong. Don't contain the fire. Don't activate the fire alarm. Don't evaluate the area. Save the patient. Okay, you need to save the patient. It's race. So remove the danger from the patient from the danger, put on the fire alarm and contain the fire and evaluate the area. Always save the patient. Number one is your right answer. Thank you for sticking around. I know I made these ones very hard. Sorry about question 9. I left at least there. So, but this is the 20 questions. This is the 20 questions for you to think about it. These questions are a little bit harder than previous one, but that is the thing. They are concept, basic care and comfort. I've told you guys, these are, it's hard to teach, but things that you have to use common sense. So take care of yourself. Thank you for sticking around. Share the video, comment, and then all the best of luck. You know where I'm located, at that class. Bye-bye.